Colon cancer is among the most common cancers that affect both men and women, ranking as the third leading cause of cancer-related deaths in the United States. Almost everyone has a colon, a long, muscular tube that, together with the rectum, forms the large intestine, an essential part of the digestive system responsible for processing food and eliminating waste. Colon cancer develops when the healthy cells lining the inside of the colon begin to change and grow abnormally. These cells can multiply uncontrollably, forming lumps or growths called polyps. While most of these polyps start out benign, over time, some may turn cancerous. Because they often grow slowly, polyps can exist quietly for years without causing pain or visible symptoms. Fortunately, they can usually be detected and removed early, long before cancer develops, through simple medical screenings that in many people, colon cancer causes no early warning signs. That's what makes regular checkups so important. However, there are certain symptoms that might signal something is wrong. It's crucial to pay attention to these and speak to your healthcare provider if you notice any point. One of the most common warning signs is a change in your bowel habits. This can include persistent constipation, bouts of diarrhea, or even difficulty controlling bowel movements. While these symptoms are often linked to less serious digestive issues, such as food intolerance or infection, they can sometimes be early indicators of colon cancer, especially when they persist over time. Another red flag is blood in your stool. You might notice your stool appearing dark, tarry, or streaked with red. Although bleeding can also come from hemorrhoids or small tears in the rectum, persistent or unexplained bleeding from the digestive tract should never be ignored. Seeing your doctor for evaluation is the safest course to rule out any serious underlying condition. An often overlooked sign of colon cancer is unexplained anemia. This occurs when your body doesn't have enough red blood cells to carry oxygen efficiently. Anemia from slow internal bleeding in the colon may make you feel unusually tired, weak, dizzy, or short of breath, even after getting plenty of rest. Fatigue that doesn't improve with sleep can be a subtle but important clue. Other possible signs include abdominal discomfort, such as pain, cramping, or bloating in the belly or pelvic area. You might also experience unexplained weight loss or episodes of nausea and vomiting without any clear cause. These symptoms can be caused by many conditions, but in combination, they may warrant further investigation. Because colon cancer can take years to develop, symptoms often appear only when the disease is advanced. That's why preventive screening is one of the most powerful tools available. Detecting abnormal growths early can prevent them from turning into cancer. And when cancer is found in its early stages, treatment outcomes are far better. The most common and accurate screening method is the colonoscopy. This procedure allows doctors to view the inside of your large intestine using a flexible camera and remove any suspicious polyps during the same session. It's quick, safe, and can significantly reduce your risk of developing colon cancer. For people who prefer less invasive tests, there are other effective screening options as well, such as blood-based screening tests, fecal DNA stool tests, and other imaging or lab-based evaluations. Your doctor can help decide which approach best fits your needs, based on your medical history and risk factors that as with many types of cancer, age plays a key role in your risk level. Experts recommend that adults begin colon cancer screening at age 45, even if they have no symptoms or family history. However, those with relatives who have had colon or rectal cancers may need to start earlier. A family history of the disease can increase risk 2 to 3 times, so early and regular screening becomes especially important in such cases. Other risk factors can also make colon cancer more likely. People of Black ancestry have a higher statistical risk and are encouraged to talk to their doctors about earlier screening options. Lifestyle habits also play a significant part. A sedentary lifestyle, excessive alcohol use, smoking, and a diet high in fat but low in fiber can all increase your chances of developing colon cancer. Additionally, obesity, diabetes, and chronic conditions such as inflammatory bowel disease, IBD, including Crohn's disease and ulcerative colitis, have been linked to a higher likelihood of colon cancer. Still, it's important to remember that anyone can develop colon cancer, even those who eat well, exercise regularly, and have no family history of the disease. That's why awareness and screening are vital for everyone, not just those with obvious risks. The good news is that colon cancer is highly treatable, especially when found early. Advances in screening technology and treatment methods have dramatically improved survival rates over the last few decades. Early detection allows for simpler treatments, such as surgical removal of polyps or localized tumors, before cancer spreads to other parts of the body. With prompt and appropriate medical care, many people diagnosed with colorectal cancer go on to live long, healthy lives. The key is not to wait until symptoms become severe, because by then, the disease may already be advanced. Regular communication with your doctor, maintaining a balanced diet rich in fruits, vegetables, and fiber, staying physically active, and avoiding smoking or heavy alcohol use can all help reduce your risk. Even small changes in your daily habits can make a meaningful difference in protecting your colon health. In summary, colon cancer remains a serious global health concern, but knowledge and vigilance are powerful weapons. Knowing the signs, from unexplained fatigue and changes in bowel habits to blood in the stool or weight loss, gives you the ability to act early. Regular screenings, especially starting around midlife, can detect issues long before they become life-threatening. Today, more people are surviving colon cancer than ever before, thanks to awareness campaigns, improved diagnostic tools, and early medical intervention. Remember, colon cancer may start quietly, but it doesn't have to end tragically. Stay informed. Listen to your body. Speak to your healthcare provider about the right screening schedule for you. Your health, your vigilance, and your willingness to get screened could save your life.